Hi, everybody. Welcome. Thank you for joining us today. We're going to give a minute or two for everybody to join this event. We're so excited to be here this afternoon or whatever time it is from where you're coming from. So I just want to let everybody know this is a very active event. Participation is encouraged. So if you have questions throughout the event, please put it in the chat and we will get to everything either during the event or during our Q&A session at the end. And just to kick things off, I'd love to ask where everybody is calling in from. So I'm in New York City. Would love for you to just put in the chat where you're located so we can get to know everyone a bit better. Love it. Texas, New Jersey, Boston, Florida, South Carolina, San Diego, Canada, San Jose. Amazing. Welcome. Welcome, welcome. All right, I'm going to hand it over to our panelists. Keep it coming. It's so good to see where everybody's from. And I'm going to, in the meantime, hand it over to our panelists, starting with Dr. Rob, our Chief Medical Officer at Let's Get Checked.
Hi, welcome everybody. Appreciate the opportunity to get a chance to chat for a few minutes here about cholesterol and the importance of cholesterol and why we test for it. I am the Chief Medical Officer at Let's Get Checked. I am a board certified physician for approximately the last 20 years, involved directly in clinical medicine, caring for patients. And I have been in the role here at Let's Get Checked as the Chief Medical Officer since 2019, and looking forward to talking about cholesterol and how we address it through our platform at Let's Get Checked. Megan, over to you.
Hi, everyone. My name is Megen Erwine. I'm a registered dietitian nutritionist here at Let's Get Checked. I'm joining from Tampa, Florida. I'm super excited to be here during Heart Health Month to talk about our topic tonight, cholesterol.
I guess it's on me then. Hi, everyone. I'm Brianna Thompson. I'm a health and wellness advocate, and I'm the founder of Spike Spin, based in Brooklyn, New York. I'm super excited to talk about cholesterol and really just healthy lifestyle. Thanks for having me.
Great. Okay, so let's kick it off. We'll go to the next slide. So I'm going to hand it over to Dr. Rob to tell you more about Let's Get Checked and what we do here.
Thanks, Rebecca. So, Let's Get Checked is truly a global company, an international company that has a mission to empower people to live healthier, better lives. And we do this by giving individuals direct access to diagnostic testing, specifically blood testing at home. But we don't begin and end there. We also provide all of the necessary clinical support to our diagnostics. So we have a clinical team that is based primarily here in the US of nurses, physicians, nurse practitioners licensed throughout the US. You met Megan briefly before, a dietitian. We also have a pharmacist on our team. We have our own lab to run our diagnostic testing, and we have our own pharmacy to provide medications when appropriate from our clinical team's prescriptions. We have a wide variety of home tests, including sexual health, men's health, women's health, and wellness. And as you can imagine, with our core competency being in home diagnostics, we were perfectly positioned to help answer the needs and the demands of the COVID pandemic. So we've done a lot of very sophisticated COVID testing as well over the last 2 years. Thanks, Rebecca.
Thank you, Rob. So we're all about increasing access to healthcare. So as Rob said, we have a range of tests that you can take right from your home, just making it really easy. And in that same vein, we want to broaden the conversation around these important health and wellness topics. And a really important topic, and the one we're here to talk about today, is cholesterol. So we'll be talking about good and bad cholesterol, what's the difference, just breaking down the essentials and the facts, what causes high cholesterol, how you can spot the signs of heart disease, what you can do to treat high cholesterol, and then generally what you can do to be proactive with your heart health. So these are the topics. If you have questions throughout, we encourage you to ask them in the chat as you think of them. Chances are someone else has the same question. So don't be shy with putting something out there. And then we'll circle back with everybody at the end to do a Q&A. So I'll hand it back over to Dr. Rob to talk us through good and bad cholesterol.
Great. Thanks again, Rebecca. So I think we've got to first get our minds around some important terminology. And you hear certainly in the common parlance about this term cholesterol. And perhaps some of you know that there are some subsets of cholesterol, of total cholesterol, something called good cholesterol and something called bad cholesterol. But being a bit more detail-oriented or scientific about it, there are different types of cholesterol in our bodies, in our bloodstream. One being high-density lipoprotein cholesterol, or HDL, as it's commonly referred to. And this is considered good cholesterol. And it has an important function in our bodies because the HDL, this good cholesterol, helps transport lipids, which are basically fats that we have in our body and through dietary sources as well, to our liver to be metabolized and to actually be expelled from our body. So, cholesterol is important, and particularly good cholesterol is important. There is another component of cholesterol called LDL, or low density lipoprotein. And this generally gets referred to as bad cholesterol. Now, it's not entirely bad cholesterol in that we all need to have some LDL in our systems. It does have important function. But the reason it's often referred to as bad cholesterol is because we know that as levels of LDL rise in the bloodstream, or if somebody has higher levels of LDL in their bloodstream, this can at least contribute to problems with atherosclerosis. So basically, narrowing of our vasculature, of our arteries. Our arteries are those blood vessels in our body that carry blood, oxygen-rich blood, from the heart to other parts of the body. And atherosclerosis means that these blood vessels can become narrowed and ultimately, in more severe cases, become blocked, which can then impair the natural and necessary process of blood flow. So LDL is called bad cholesterol specifically because of its role in that component of disease, that it can lead to narrowing and blockage of arteries. Next slide, please. So as I just mentioned, we need good cholesterol. This is actually, good cholesterol actually has a protective effect. So seeing your levels of good cholesterol, of HDL in your bloodstream and your blood work actually can be beneficial if you find that you have good levels or higher levels of the HDL. It's thought that this actually has some cardioprotective effects, meaning that it's protective or at least helps limit, minimize developing heart disease and heart conditions down the road. And we don't believe that there's much evidence to suggest that having higher levels of good cholesterol is deleterious, is a bad thing. And so when somebody says, I have high cholesterol, what you really want to drill into is the more detailed understanding of, well, what component of your cholesterol is it that's elevated? Is it the total cholesterol? And the thing you really want to hone in on is, what are the levels of your LDL? Are those possibly elevated? That's where you get into real trouble. But do you have HDL levels, these high density lipoprotein levels, that might be low? If they're low, we want to take efforts to try to raise them a little bit. We're going to learn about some of those efforts a little bit later in the conversation. Next slide. And as I mentioned briefly before, it's not that we want to eliminate bad cholesterol from our bodies. In fact, we need LDL or this bad cholesterol in our bodies. It's vital to proper function of our internal ecosystem. But where we get into trouble is when those levels of bad cholesterol begin to climb, that's where you start to lead towards longer term bad effects on blood vessels and ultimately potentially into heart disease. Now, what are normal values and certainly what are acceptable values do vary a little bit from person to person. And there's a lot of factors that need to be considered by a clinician when assessing somebody's blood panel results around their cholesterol, including their age, certainly any family history of prior heart disease or vascular disease, and then personal history of those problems as well need to be considered when you're trying to really interpret what your levels might be and the significance of how you might try to impact them in the future. So when we look at the ratio or the amount of cholesterol, of bad cholesterol and good cholesterol in the bloodstream, and if any of you in the audience have actually gone ahead and done a blood panel, and if you've done one with Let's Get Checked on our heart test, you'll see that you don't just get a cholesterol result, but you actually do get a breakdown in the amount of HDL, the good cholesterol, as well as the bad cholesterol, the LDL. And in fact, we also measure something called triglycerides, just to further confuse the story. Triglycerides are not cholesterol, but they are other lipid values that circulate in our bloodstream. And also, when triglycerides can get elevated, that also may lead to further vascular problems and risk for heart disease. But when we measure LDL and HDL, we know that as a normal result, there's going to be more bad cholesterol in you than there is good cholesterol, and that's okay. That's an okay finding. We just want to make sure that bad cholesterol doesn't get too high, because again, that's where you're going to get into some trouble. Megan?
All right, thank you, Dr. Rob. So as Dr. Rob mentioned, cholesterol isn't all bad. We actually do need some cholesterol in our system to be healthy. It's, again, when that LDL gets too elevated that we may start to run into some problems. So genetics definitely plays a role in our cholesterol levels and how our body metabolizes cholesterol, but so does our lifestyle. So we are going to take a closer look at some of these factors that can contribute to high cholesterol. Poor nutrition is one. Most Americans are just eating way too much saturated fat. And saturated fat are foods, things like full fat dairy, red meats, processed meats like bacon and sausage. And too much saturated fat in the diet can lead to that elevated LDL cholesterol. Also, a lot of us aren't just getting enough fiber in our day-to-day diet, especially soluble fiber. Soluble fiber is really important with cholesterol because it actually binds to that cholesterol and removes it from your system. So if we're not getting enough fiber day to day, it can certainly impact our overall cholesterol levels, specifically that LDL cholesterol. Also trans fat. Trans fats are artificial fats that are found common foods that we may be choosing on a day-to-day basis. And they not only increase your LDL cholesterol, but they decrease your HDL cholesterol, your good cholesterol. So the trans fats they're not naturally found in foods, they're added to foods. So they're going to be found in a lot of those overly processed foods. Think of things that you might find in the refrigerated aisle or the frozen convenience section of the grocery store. Things like the refrigerated biscuits or frozen pizzas, snacks that can stay on the shelf for a long time are typically contributors of trans fats, like packaged cookies or the crackers with the cheese or peanut butter inside. Those are where you're going to find your trans fats. And too much trans fat, like I said, can do negative things to that blood cholesterol level. The next contributing factor of lifestyle would be lack of exercise. Not nearly enough Americans are getting the amount of physical activity that we need each day, and that's going to contribute to high LDL and low HDL. And I know Brianna is in her expert area with that, and she'll be giving lots of good information on our exercise as well. Smoking is another factor, and vaping as well. So smoking and vaping can actually lower your levels of HDL cholesterol in your system. So if you are a smoker, quitting smoking can really significantly increase that HDL, that good cholesterol for you, and relatively quickly. Another one is age. So From about age 20 on, our cholesterol levels do naturally begin to increase. That LDL receptors in our system just aren't working as well as they did. So they kind of become a little bit less active as we get older. But it does kind of start to plateau for us. For women in between ages of 60 and 70, we see that plateau. And for men a little bit younger in between ages of 50 and 60. Okay, and the next slide has some more contributing factors that we'll go through. All right, excessive alcohol consumption may definitely increase your LDL cholesterol and your triglycerides that Dr. Rob mentioned just a moment ago as well. And that really is dependent on how often and how much alcohol you're consuming, but definitely something that could contribute to it. Chronic stress, if you're living with chronic stress, you could have higher cholesterol levels due to the constant supply of cortisol and adrenaline that is being released from your adrenal glands. Obesity is a big one as well. Not only excess body weight, but especially the fat that kind of, hangs around in the midline. So that belly fat can certainly increase your triglycerides, your LDL, and again, drive down that good cholesterol, that HDL. So when we're thinking about the belly fat or the waist circumference, men that have a waist circumference at 40 inches or above and women at 35 inches or above is definitely a contributor to higher cholesterol and increasing your risk for heart disease. And then lastly, we'll talk a little bit more about diabetes on the next slide as well. But if you're living with diabetes, you are at higher risk of having elevated cholesterol too. They just kind of go hand in hand. And those that are following a very unhealthy diet can certainly put themselves at higher risk for being diagnosed with type 2 diabetes. Okay, next slide. All right, so like I said, diabetes is associated with lower HDL levels and higher LDL levels, increasing your risk for heart disease and stroke. So not only is it super important to check your cholesterol levels and be aware of what those numbers are, but you also want to know what your blood sugars are running. There's some numbers out there that I always like to share. 7.2 million Americans have type 2 diabetes, but they don't even know. So very important to get your blood sugars checked. There's another 84 million people that are in that pre-diabetic range. And what I mean by pre-diabetic range is that their blood sugars are coming back elevated, but they're not yet elevated enough to get that diagnosis of type 2 diabetes. And people with pre-diabetes are still at greater risk for heart disease as well. So definitely important to not only take a look at your cholesterol levels, but taking a closer look at the blood sugars as well. Okay, and back to you, Dr. Rob.
Thank you. So we're going to talk a little bit now about the signs of heart disease. And I think that the point of emphasis here that I think we need to make is, why are we really even talking about all this cholesterol stuff today? Why do we at Let's Get Checked, and certainly most clinicians around the country, test for cholesterol? Why is it a topic of question and concern, of monitoring? And really, it's because of the impact and the correlation that these cholesterol levels may have on leading to heart disease. And as many of you are aware, heart disease is a leading cause of death in the US. And so in an effort to try to combat heart disease, we need to really make an effort to identify what your cholesterol levels may be, and when they're abnormal, begin to take the steps to try to get them back in line. And I think as demonstrated here, we can see that there is a significant portion of the population that, unbeknownst to them, are walking around with abnormal elevated cholesterol levels. And so this is why this is important, because if we go to the next slide, the problem over the long haul with those elevated cholesterol levels, as I said, that will lead to blood flow issues and atherosclerosis, which can then lead to heart disease, ultimately leading to the potential for a myocardial infarction, a heart attack. So what would be some of the signs or symptoms that a person might look for to find that they have heart disease? Well, some of it may not be very subtle. Crushing chest pain, I think, would hopefully raise everybody's concern that they've got a problem and proceed immediately to get emergency help. But sometimes it can be a little bit more subtle. It doesn't have to be crushing chest pain, but just maybe some intermittent chest pain, or just pressure on the chest. Difficulty with breathing, shortness of breath, certainly any pain that would happen in the throat, in the neck, pain or numbness in the arms, the legs, or in the upper back. And so, these are signs and symptoms that if you feel like you may have been experiencing them, or a friend or a family member that may be complaining of some of these, that you should get these evaluated immediately. And I'm not suggesting that if you have one of these, you definitely have heart disease and are imminently about to have a myocardial infarction, because there can be a lot of different diagnoses or explanations for some of these symptoms. But certainly, given the prevalence of heart disease throughout the world, and certainly in the US, these need to be at the top of the list to be ruled out when somebody starts to develop these types of symptoms. And I think that one of the common misconceptions is, well, as long as I only get these symptoms when I exercise, then I must be fine. That's not exactly the case. These can be very nondescript. They can happen at rest or at exercise. They're more common at exercise than at rest, but not necessarily. And again, these can be very nondescript, types of symptoms, and just warrant further evaluation. I saw there was a question around, neck pain or throat pain. Really, what we're talking about here is, this can be something that happens in the side of the neck or down the neck, and it just has to do with the way that the nerve innervation can happen when there begins to be impact on blood flow to certain vital organs and portions of the heart. Next slide, please. We mentioned those before. These are the ones I just kind of ran through, warning signs of a heart attack. But I think the point to hammer home here is that, in many patients, a heart attack, a myocardial infarction is the end game, or the end result of the process of atherosclerosis, narrowing of blood vessels, and disease of blood vessels. And that is predicated, or at least helped along, by cholesterol levels being abnormal and out of round. And so the idea is that if we can identify through blood testing the abnormalities very, very early, we will not allow the years of progression that will eventually lead to some of these really, really serious heart problems. And so, we can hopefully prevent a lot of these by a better screening and then better action based on that screening. So Brianna, maybe we'll kick it over to you to talk a little bit about, maybe some sort of initial ways that one might go about trying to keep their levels in line or get them back in line.
Yeah, I love everything that was shared. And I think all of it is at a high level, things that we don't pay attention to every day, because unless you do a test, and unless it's brought to the forefront of your mind, or you're experiencing some of those things, do you think to pay attention to your cholesterol or your levels across the board? And so I think one of the best ways to at least stay ahead of it before you get to the doctor's office and have to hear some of those test results is to make decisions that you can be in control of, which is your lifestyle. And I know Megen mentioned before, drinking limited, but I think what is most important is getting up and getting your body moving. And so one of the points that we see here is that when you're stressed, it has the power to impact your overall heart, and physical inactivity and overeating. These are all things that obviously are a part of impacting our heart health, which is what we want to make sure that we're staying in front of. And so getting the body moving, it's recommended that you move at least 30 minutes per day, 5 times a week, or 20 minutes of vigorous activity 3 times a week. I like to tell my clients, it's important to start where you can. Health and wellness is not a 30-day track or a 60-day jump fast. It's definitely something that you're going to need to pay attention to as long as you're alive. And so there's no need to psych yourself out before you even get started. If you can begin with committing to something as simple as 5 minutes a day of movement, 10 minutes a day of movement, and allowing yourself to build up, I think that's a way to ensure that you don't overwhelm yourself, but you also keep in mind the areas of opportunity for you to make smart lifestyle decisions. One thing that I like to focus on is communities of color, because unfortunately they're leading in most of these diseases. And one thing that I like to call out is that all of these diseases can be preventable if we make the right choices. And so high blood pressure is linked to diabetes, is linked to obesity. And so if we can find ways and opportunities to improve those areas, losing weight, making smarter food choices, and getting up and getting the body going, then I think we can do our part in improving some of those lifestyle options. And so I know that when you hear it through the lens of numbers and cholesterol, it can sometimes seem daunting, but if you take a step back and think about, what am I doing that can positively impact this on a day-to-day without overwhelming myself, that's the easiest place to begin. So I always tell my clients, find opportunities to be realistic with your lifestyle, and where are you willing to carve out time for you? What does that look like, and how do you commit to that? Starting small and remembering, health and wellness is not a 30-day stint. It's literally a lifetime. And so I always just want to encourage you to think about your life in decades, and how can you maintain yourself over time and not just an immediate quick fix.
I love that, Brianna. And the same thing goes to nutrition that she spoke upon with exercise and lifestyle in general. There's no magic diets out there. There are sustainable strategies that we can be consistent with that are really going to make the difference for our long-term overall health and well-being. When it comes to cholesterol, there are a few strategies that we should start working towards to help maintain healthy cholesterol levels. The first one is saturated fat. So saturated fat, we want to make sure that we're not getting too much saturated fat, because it can raise the cholesterol levels in our body. Saturated fats are primarily from animal sources. So things like beef, pork, eggs, full fat dairy, so your whole milk, and tropical oils like coconut oil and palm oil are also saturated fats. So we want to be choosing those fresh, lean, unprocessed meats, things like fish, chicken, turkey without the skin, and focusing on some plant-based proteins too, maybe working in soy and working in some beans for some lean plant-based proteins. On the flip side of saturated fats, we have unsaturated fats, and unsaturated fats are those healthy fats that actually improve our LDL cholesterol when we choose them over saturated fats. So your unsaturated fats are predominantly plant-based sources. So things like avocados, things like nuts and seeds and peanut butter and almond butter. Those are going to be your and olives. I saw somebody just have a question about olive oil. So those are going to be your primary sources of those unsaturated fats. And again, we want to find places, a small thing that we can do, find places that we can substitute those saturated fats for unsaturated fats. So if you're somebody that eats a piece of toast with butter for breakfast every morning, instead of using the butter, the saturated fat, maybe try a couple slices of avocado spread on there, or some peanut butter or almond butter. Swapping out that saturated fat for unsaturated fat can make a big difference. Omega-3s are also an unsaturated fat as well. Omega-3 fatty acids are found in fish and are known for decreasing our LDLs and our triglycerides and our blood pressure, and supporting that HDL, that good HDL in our system. There are some plant-based sources of omega-3s as well, things like walnuts and flax seeds and chia seeds, if you've ever tried those before. The main thing is really just to place emphasis on that whole unprocessed diet. We want to try to sneak in as many plant-based foods as we possibly can. Our fruits and our vegetables, we really underestimate the power of these plant-based foods, nuts and seeds for that ultimate heart health and overall health. Now, the reason that those foods, the foods made from plants are so incredibly important when it comes to cholesterol is because, again, they have a lot of fiber. I mentioned fiber earlier in our talk, and fiber is going to latch onto that cholesterol and drive it out of our system. So it's super helpful to help manage the cholesterol. But there's also different compounds that come in a lot of plant-based foods that actually can block absorption of cholesterol as well. So Dr. Rob mentioned at the beginning that we get cholesterol from our diet, and our bodies make cholesterol. So if we have more of that plant-forward approach and incorporating lots of plant foods, it can certainly help with the cholesterol that's coming from our foods, as well as the cholesterol that's made from our body. Next slide, I think it's back up with Dr. Rob.
Thanks, Megan. So, we've talked a bit about some of the really important lifestyle changes that one can impart to try to improve their cholesterol profiles and ultimately the end goal being to reduce their risk of cardiovascular disease, heart attack, stroke, etc. But unfortunately, that doesn't always work. And these lifestyle programs, I should mention, should always be first and foremost where an individual should start. Many of the things that Megan mentioned earlier around exercise, about limiting alcohol, not smoking, eating the proper diet, these are really going to always be the foundation and the mainstay of how we want to go about trying to improve our health and the health of our patients. But there are going to be individuals who, quite frankly, their numbers just don't get better or don't get dramatically better or at least significantly enough better through those methodologies. Some of us simply have genetic predispositions and higher set points for these cholesterol levels in our body. And so this is where medication can be helpful. The medications that are used to treat high cholesterol are what are known as a group of medications called statins. And they work by essentially having the body limit or reduce the amount of bad cholesterol and triglycerides that it produces. So they work to inhibit a certain enzyme in our bodies that lead to these elevated cholesterol numbers. And so again, we don't want to always be starting with statins, but they are in our armamentarium that we can make available to individuals when needed. Next slide, please. Now, are these safe and effective? They are. They certainly can have some side effects. Most patients that go on statins tolerate them well, but there are certain side effects that some patients might find difficult. In probably about 5% of patients, they can have some muscle discomfort. In rare cases, it can lead to more significant issues there or elevation in liver enzymes. But again, these are rare for the most part, and these are generally well tolerated. And sometimes we find that, and there are different varieties or different choices within the medication class of statins. We might find that a patient doesn't respond as well to one medication and might need to go to a different medication down the line. Certainly through some of the emerging pharmacogenomics strategies and testing that we can do, we can sort of predict where a patient might find more benefit from a certain medication or better tolerability. But those are things that are just starting to evolve now. How do we go about deciding who ought to be on statins? Well, I mentioned earlier that we certainly are always going to want to try to start through lifestyle modifications and diet modifications. But if we find that somebody's cholesterol numbers are not improving despite concerted efforts to undertake those efforts, then we're going to want to think about where statins might fit in, looking at somebody's family history for heart disease, also other things that might predispose them to developing heart disease, like poorly controlled blood pressure. Pre-diabetic or diabetic patients certainly are going to be at high risk for heart disease. So these are patients that we're going to want to be more aggressive in terms of managing their cholesterol and doing so probably through at least the addition of medication. And then there are some risk calculators that have been validated that are available that we utilize with our clinical team at LetsGetChecked to try to figure out really who is appropriate for these medications. Being able to predict based on their cholesterol panels and their blood pressure, what is their risk at 10 years to develop heart disease? And if they've got a significant risk at today's point in time, let's get them on statins. Let's then monitor their cholesterol levels going forward and see if we can reduce that risk over time. A thing I want to just emphasize here as well as we've been talking is, we talk very much about managing this at LetsGetChecked on at an individual level, so that we do this for individuals. The term is the direct to consumer model, right? That a consumer can come to us, do this testing, and be able to get their care. But we also can do this for large populations as well. So, for employer groups, for large third-party payer insurance companies, we can take large populations, and then within that population at a large level, once we've done screening, begin to individualize those people that may be at more risk and would benefit from further focus and potentially for therapy, including medication. Megan, how do we be proactive then?
All right, so we can certainly do a lot of things to be proactive, Dr. Rob. We can look out for those signs of heart disease like you just went over, and certainly understand your family history as well. Again, we want to eat well and focus on decreasing those saturated fats. I think I've said that several times this conversation, and increasing those unsaturated healthy fats, as well as increasing that fiber, focusing around all those plant-based foods that we can fit into our day-to-day diet. We definitely want to be moving more, as Brianna spoke about, and certainly sit less and focus on some good sleep patterns. 7 to 9 hours of good quality sleep is what our body needs to maintain health and well-being. We also want to make sure that you're taking your cholesterol lowering medications if you need to, or determine if cholesterol lowering medications are right for you. Is it something that you need to add to your regimen to stay healthy? We also want to take a closer look at knowing our cholesterol levels. We cannot stress this enough. We need to test our cholesterol levels. High cholesterol has no symptoms, so the earlier we're able to identify, the better we can protect ourselves from heart disease. So really important that we are testing those cholesterol levels and testing them regularly. And I believe, Dr. Rob, you're up again. You're still on mute, Dr. Rob. There you go.
Got it. Hit the button. There we go. My apologies. So what can we learn? Well, I think the component to this that matters more than anything is obviously you need to know your numbers. And that means getting a cholesterol test done. And then doing this on a regular basis so that you're tracking your numbers over time. Obviously, it'll be nice if at the point that you do your initial test, your numbers are good, but let's make sure that they stay good. So, as Megan mentioned, as a normal aging process, our numbers can increase, our cholesterol numbers will increase. So we want to track this over time. We don't want just one point in time, but we want to be looking at this on a regular basis. If you start off with numbers that are pretty normal, then maybe once a year is enough. If you certainly do an initial screening test and you find your numbers are abnormal, you want to start down the path of trying to get this in the right direction through some of the lifestyle modification and recommendations. Go back and test 3 months later after you've made a concerted effort to bring in some of those lifestyle changes and see if your numbers are getting better. And if they're not, then that may be the time to begin thinking about medication therapy. I think another reason that getting these numbers tested matters is because there are going to be people whose numbers are really out of whack. We've sort of been describing a sort of typical patient with typical elevations in numbers, but there are some people who have very high numbers unbeknownst to them because otherwise they're asymptomatic, and they may need to go into even further testing to really look at what may be an underlying problem, such as, do they have a real genetic issue at an endocrinologic level that's leading to really, really abnormal levels. There are other more specific testing that can be done besides what we've talked about today around HDL and LDL, but there are APO testing and something called VLDL that can be done. And really, if you've got somebody who is at high risk for cardiac disease, particularly based on a bad family history or bad numbers that have been hard to bring under control, there may be other diagnostic testing that's needed as well, usually done in concert with a cardiologist, where you would do something called calcium score testing, which is usually done through a CAT scan, imaging of the heart vessels, and maybe even more sophisticated testing from there with cardiograms and some of this kind of stuff. So it can get pretty detailed, but I think a jump off point for everybody is just get to know your numbers as your initial starting point. And so, I think this is the real power of certainly what we believe we have at Let's Get Checked, is the ability for really anybody that's on this call today through our at-home platform to be able to order a cholesterol test, to self-collect that test and get an actionable result, which would then at least give you your starting point. We can help with that with our clinical team in terms of trying to help get numbers under better alignment if they're not. And again, also if the numbers are really out of whack, help to get you pointed in the right direction to get even more sophisticated testing that might be appropriate. So thank you.
I can jump in. Thank you all for the very insightful and educational content. We are currently offering a special offer just for those who have attended this event. We're offering 30% off all of our heart health tests. So you can use the code heart30, and that will give you that 30% off discount. We're also going to send an email to everybody who RSVP'd for this event, and we'll include that discount. We'll also include a recording to the event so you can rewatch it or share with anyone who might be interested that missed it. Okay, with that, I think we're going to do some Q&As. Great, thank you all for your questions throughout. There are quite a few. I'm going to start with some diet questions. We got a lot of those. Megan, we had a lot of specific questions. I'm just going to throw out a few different things and you can tell us if they're healthy or not healthy or what the deal is. We were asked about soy. We were asked about fish types that are healthy or not healthy.
Okay.
Why don't we start with those? Soy,
Yeah,
fish
so
types,
let's stop there.
Call out?
Okay, so as far as those heart healthy fish that are going to be full of omega-3s, we really want to focus on things like trout, rainbow trout, and specifically mackerel, salmon, and tuna tend to be the fish sources that are going to be higher in omega-3s for us. And as far as soy is very heart healthy. Soy is very high in plant-based proteins. There's little to no saturated fat. It's high in fiber, high in antioxidants, all those good healthy things that we want to be putting in our body. And it's a great alternative to meat and to full-fat milk. We consume soy milk here in our house. And like I said, it's a great alternative. You could also look at ways to, make an edamame stir fry or a tofu stir fry, leaving out that meat and having that as a good plant-based protein substitute.
And does tuna include canned tuna?
Tuna does include canned tuna, yeah.
Great.
Wild caught's always going to be healthier too. I did see that pop up.
Okay, perfect. I'm going to come back with some more diet questions for you, but I'm going to go over to Brianna. We have some fitness questions I would love for you to answer. And people want to hear from you. Is a 10-minute walk 3 times a day as good as one 30-minute walk? Does it provide the same benefit?
Yeah, I was actually going to respond to that question in the chat. It actually does provide the same benefits if you are walking briskly. I think the point that you want to think about whenever you're doing these short stints of cardio specifically, you want to make sure that you're doing something intensely. So 10 intense, 3 10-minute intense walks would be comparable to a 30-minute workout. If you're leisurely walking, then that would not count. So just think about how vigorous the workout is.
Thank you. And then another one for you, in addition to running or walking, what types of exercises do you recommend to boost heart health?
Anything cardio is going to be beneficial to the heart. So when we think of fitness, we think of it in 3 categories. So there's aerobic, which is you're running, you're jumping, you're riding your bicycle, you're swimming. I highly recommend swimming and biking and walking because they're easier on the joints. And Dr. Rob, you can keep me honest with some of these things, but that's typically what I recommend to my clients. And then there's strength training, which has other benefits in making sure that your body stays strong and able to carry you through the years. And then you want to think about your flexibility, things like yoga or Pilates or just simply stretching. And so I like to recommend the trifecta, all 3. But if you're specifically thinking about your heart health, you definitely want to get winded. If you think about things that'll make you winded, so again, the running, the vigorous walking, the swimming, those are all things that are going to be beneficial to the heart specifically, although everything is.
Okay.
Yeah, Brianna, you make a great point. I mean, I'll jump in on that really quickly, which, I always love these conversations about, should I do 10 minutes of this versus 30 minutes of that? Should I eat more fish? Should I, the answer is yes. I think, not to get too into the weeds, but the reality is, like, if you can do 10 minutes a day, and that's all you can do, then do it. If you can do 30 minutes, then do 30 minutes. I mean, obviously there is a point of sort of excessive, but I think for most people, these are really about getting started. And you mentioned that earlier, which I think is a great point. You can't take your 10th step until you've taken your first step. So, get started, get out there, get exercising, get your heart rate up, get yourself a bit winded, and then try to do it on a regular basis. And whether that's 10 minutes or it's 15 minutes or 30 minutes probably doesn't matter as much as the consistency component. I think there was a question earlier, which I think is a really good one, and Megen commented on it earlier around stress. Whatever we can do to keep our stress levels down. It's always easy to say, get your stress under control. That stresses me out just thinking about it. But, meditation, there's a lot of great meditation apps out there now, yoga, just the aerobic exercises that you mentioned, Brianna, getting out and walking can help be a great stress reliever as well. So stress is a big component. And then I'll jump on one other thing, which was around the components of diet that Megan's touched on, the importance of fish. A lot of patients will ask me around supplementation and taking omega-3s and some of this. And my general feeling about that, and Megen, I'm going to put you on the spot here. My general feeling is that you can't supplement your way out of a bad diet. In other words, you can't go and eat terrible fast food all day long and then just say, well, I'm going to take omega-3 every night before I go to bed, and therefore I've done a good job of fixing my omega-3 fat levels, which are going to help my cholesterol. Omega-3 is an important component, but when you eat fish, healthy fish, and particularly wild caught fish, you're not just getting the omega-3s, but you're getting the all of the other substrates that come along with that are important to transport these things into our bodies for absorption and transport into our cells. So my general answer there is you can't supplement your way out of a bad diet. But Megen, I'd be curious to your thoughts on that comment as well.
I agree, absolutely. And you can't out-train a bad diet either, right, Brianna? But yeah, supplements may help in individual situations, but absolutely the recommendation is to really focus on those fundamentals first. Start with your physical activity, start moving more, start focusing on proper nutrition, sleep, stop smoking if you're smoking, cut back on alcohol. So those things are what are going to collectively make a much better impact with protecting your heart rather than just taking a certain supplement.
And Megen, I just want to add to that because we do get so many questions of like, can I work out? X amount of calories will be burned. Your diet is one of the most crucial elements of your lifestyle. I think that we don't put enough emphasis on it. I would prefer you to eat well and move less than to eat whatever you want and just kind of work out for hours and hours on end. Your diet is what is feeding you literally. And so I think being thoughtful in what you're ingesting is always going to be my first plan of attack for your lifestyle, followed by obviously moving your body and de-stressing and sleeping well, which I never get to do, but all of those things that add to it.
This is so great, such great dialogue. Dr. Rob, can you speak to why it is recommended to not start taking statins until you're 35?
Well, I'm not sure I would say that it's not recommended. There certainly are patients that are appropriate for statins prior to the age of 35. But typically, if you've identified, or if somebody's been identified as having cholesterol levels that are that out of round that early in life, we would be concerned about some underlying genetic component perhaps driving this. And so, these are patients that probably need pretty sophisticated care from a cardiologist, an endocrinologist. And if you're being identified that early in life, then you may need something a bit beyond that. A lot of it depends on how bad the levels are. If somebody just has mildly elevated levels, if they're 30 years old, mildly elevated levels, they're a bit overweight, they smoke, they have a strong family history of heart disease, that's going to be a different patient, and perhaps they might be appropriate for treatment. So I don't think that there's a hard and fast rule there. But I think the thing to point out is that if somebody's identified very early in life with really bad numbers, we're going to want to get them, more sophisticated testing beyond simply, screening and sort of just HDL, LDL.
Thank you. And can statins be a temporary thing? So once your numbers are improved, can you wean off statins, or do you have to keep taking them?
Yeah, that's a great question. And yeah, I mean, the hope is that you can get somebody off them. I think it all depends, where you finish might predicate a lot on where you start. So if you have somebody whose numbers are certainly indicative of a higher risk of developing heart disease down the road, but at the point of entry, they've got some issues with weight, their blood sugar's a bit out of round, they haven't done a great job with diet or exercise yet, perhaps they're smoking. A lot of times if you can get somebody to engage in some of those activities, and they do it over the long haul, and they really commit to those lifestyle changes, you may be able to use the medications to help move the numbers in the right direction, but hopefully eventually they can potentially get off them. Now, there certainly are a lot of people who go on statins who may need to be on them long term, but that's not everybody. And so, the goal would be to try to get them off, depending on what their numbers may do, or it may require dose adjustment. You may have to start at a higher dose and then be able to potentially back them down over time. So it'll change. And again, I think it just points to the importance of knowing what your numbers are. That's why you need to get testing on a regular basis to be able to monitor this and then make adjustments when necessary. One size does not fit all.
Got it. And are there any side effects with statins, taking them specifically?
Yeah, I mentioned earlier, I mean, there are a few patients, single-digit percentage of patients that might notice some muscle soreness with it. More sinister things like, real muscle damage or liver damage, or cognitive effects in terms of, some foggy thinking and stuff like that. These are very, very rare. They've been reported, but these are very, very rare. And so generally these are considered quite safe to be used. And there literally are millions of patients that are on these medications today.
Got it. We just got one question in around how often should you be checking your cholesterol?
Well, I think I mentioned earlier, I think it a little bit depends on, where you end is where you start. So it depends on, if you start off and you check your numbers the first time around and your numbers are good and you're otherwise healthy, and you adhere to sort of all of the good health activities and lifestyle things that we've mentioned today, it may be reasonable to check it, every, even maybe every few years, depending on your age. As you get a bit older, or certainly if you have a family history of heart disease, or if your numbers initially are borderline or even a little bit elevated, I think probably checking them more frequently is important. So maybe once a year. And if you're somebody who has had elevated numbers and you've now made the efforts to bring them into the normal range, then certainly once a year is going to be good. And if you're somebody who's in the process of bringing your bad numbers into range, and certainly if you're doing that with medication, then you're going to need to be checked even more frequently than yearly. Maybe initially when you start medications, you're going to need to come back and check it about 3 months. And that's what we certainly have in our cholesterol care pathway as part of our process, where once the decision has been made mutually between the clinical team and the patient that statins are the right approach, we're going to go ahead and get them started. Our pharmacist is going to reach out to that patient to make sure that they understand how to use the medication, that they're not having any side effects once they have started the medication. And then we're going to want to make sure that we bring back testing to them at about a 3-month interval. And let's make sure that at least if the numbers aren't normal, that they're at least trending in the right direction. We don't need to start adjusting medications or looking at other options.
Thank you. I would like to ask Brianna a question around, you were talking about health equity, and if you could share any thoughts around like what companies like LetsGetChecked can do to just increase access for all and create more health equity around these, healthcare solutions.
I think these conversations are awesome, but I also think if you're not looking for it, they're difficult to find. And so when I think about health equity in communities that need it most, it's really being present where they are, because they tend not to be looking for what they need. And And that's kind of why I take a gentler approach to even making lifestyle changes, because I understand that it's daunting. A lot of the information that was shared here today is incredible, but it will go over so many people's heads that are just frankly unfamiliar with things that they should be familiar with. So I don't want to understate or overstate that people are unaware, but if you look at the numbers, they're unaware. And so I think companies like Let's Get Checked could maybe come into the community and do like a pop-up event, or continue to partner with brands that are local in the community where they could be potential clients. I think it's mainly just figuring out, how do you put yourself in front of them instead of them having to seek you? Because I find that it's less likely for them to seek you versus you go out and let them know, like, we are here, this is how you use it, and this is how it will ultimately be beneficial for you.
Thank you so much for sharing that. Okay, we only have a few more minutes, so I just want to make sure we get any final questions in. Does insurance cover these tests? Dr. Rob?
So right now with Let's Get Checked, it does not. Clients can always try to submit to their insurance company for reimbursement, but we are not in network with those insurances. With some of our larger business-to-business partners, we do have arrangements that within a certain group of patients or panels or insurance that they might be able to be supplied through them. But generally speaking, for access to these, for an individual, they're going to go to our website or on the app on their phone, the Let's Get Checked app, and they're going to go ahead and order this and pay out of pocket. If they have health plan savings in place, they can sometimes use those funds to pay for our tests.
So your HSA and FSA should cover this.
Correct.
Perfect. And I know we will be in network soon, so stay tuned.
Absolutely. We are working towards that, actively working towards that.
Okay, any final thoughts? I don't know if you covered, Megan, but intermittent fasting, keto diet, maybe just rapid fire thoughts on any diets that work or what you think about that.
I knew we wouldn't finish this conversation without bringing up keto. So if you think about what we talked about tonight, we talked about increasing fiber and decreasing saturated fat. The ketogenic diet has a significantly high amount of fat that's recommended to put your body into that ketosis stage. So it's very difficult to do for a long time and make it sustainable for any sort of weight loss or health reason. But not only that, is that if you're able maybe to perhaps pull off that amount of fat from day to day with those healthy fat choices, those unsaturated fat choices, then it could be a little bit more heart healthy for you. But overall, with the keto diet, you're really decreasing the fiber, increasing the saturated fats, and it's not that sustainable for long-term health outcomes.
Got it. Thank you. Okay, in the final minute, I just want to pass it back. If any of you have anything you want to add or share, any final remarks?
Know your numbers. I think that's my take home. It's easy enough to do it now through a group like ours at Let's Get Checked. You can know your numbers. The power's in your own hands, and so that's what I would say. I did see real quick. I did see something that came up here about coronary X-ray versus cholesterol testing. Really quick, coronary artery testing with CAT scan actually is what you're talking about. Looking at calcium scores can be an important component if somebody has a risk of heart disease or has known bad cholesterol in the past. I think cholesterol testing is your starting point, but it may not be the entire picture depending on how things go.
Thank you so much. If you had questions that did not get answered, you can reach out to us, support@letsgetchecked.com. We have a whole care team that's here for you. You can also find Brianna on Instagram. Brianna, if you want to share your handle.
Yeah, I'm at bri.monee, BRI.MONEE.
Thank you.
And I love to chat about anything sustainable health and wellness is
amazing. You can put that in the chat, maybe if you want people to see that, and email us, follow Let's Get Checked on Instagram. Look out for the email we're going to send with this recording with that discount. That discount is Heart 30. and you can use it on any of our heart and cholesterol tests. So we really encourage getting tested, finding out your information. Get empowered with knowledge. And thank you for joining us. Really appreciate all of your time, and thank you to our wonderful panelists. It's a great conversation. We all learned a lot.
Bye all. Thank you.